Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about diabetic nephropathy. We are going to see what is diabetic nephropathy is, what are the symptoms of it, causes, complications, test, treatment and precautions. So let's get started. What is diabetic nephropathy? Long-term diabetes that isn't well controlled can damage blood vessels in the kidneys. This can lead to kidney damage called as diabetic nephropathy. Now let us see the symptoms of it. In the early stages of diabetic nephropathy, there might not be any symptoms, but in later stages, symptoms may include high blood pressure that gets harder to control, swelling of ankles, feet, hands or eyes, foamy urine, confusion or difficulty thinking, shortness of breath, loss of appetite, nausea and vomiting, itching, tiredness and weakness, trouble sleeping or concentrating, weakness, abnormalities in the heart's regular rhythm because of increased potassium in the blood, and muscle twitching. Now let us see the function of the kidney. One of the main jobs of your kidneys is to filter blood. They get rid of extra fluid and waste products from your body through your urine. Your kidneys also remove acid that is produced by the cells of your body and maintain a healthy balance of water, salts and minerals such as sodium, calcium, phosphorus and potassium in your blood. Now let us see the causes. High blood sugar levels can damage the small blood vessels and tiny filters in your kidneys called as Glomeruli. This can cause them to leak and not work as well. When this happens, abnormal amounts of protein from the blood can leave your body in your urine. This is often an early sign of kidney disease. Now let us see the complications. Complications of diabetic nephropathy gradually develop over months or years. The first complication is the fluid buildup. This could lead to swelling in the arms and legs, buildup of fluid in the lungs called pulmonary edema, and high blood pressure. Next complication is the hyperkalemia, a rise in the levels of the potassium in the blood called as hyperkalemia. Potassium is generally stored in the fluid inside of the cells, but when there's too much glucose outside of the cells, potassium moves outside of the cell, raising potassium levels in the blood. Next complication is the cardiovascular diseases. Over time, high blood sugar can damage blood vessels and the nerves that control your heart. This is because your body can't use all of this sugar properly. So more of it sticks to your red blood cells and builds up in your blood. This buildup can block and damage the vessels carrying blood to and from your heart, starving the heart of oxygen and nutrients. Next complication is the anemia. Diabetes often leads to kidney damage, and failing kidneys can cause anemia. Healthy kidneys know when your body needs new red blood cells. They release a hormone called erythropoietin, which signals your bone marrow to make more red blood cells. Damaged kidney don't send out enough erythropoietin to keep up with your needs. If it is positive for anemia, it can be an early sign of or a problem of kidneys. Now let us discuss about the tests. The first test is urinary albumin test. This test is done to detect a blood protein called albumin in your urine. Typically, the kidneys don't filter albumin out of the blood. Too much albumin in your urine can mean that the kidneys aren't working well. Next test is urine albumin creatinine ratio. The albumin creatinine ratio measures how much albumin compared to creatinine is in a urine sample. A normal amount of albumin in your urine is less than 30. Anything above 30 may mean you have kidney disease. Next test is glomerular filtration rate. The measure of creatinine in a blood sample may be used to see how quickly the kidneys filter blood. This is called glomerular filtration rate. A low rate means the kidneys aren't working well. Doctors determine the stage of kidney disease using the GFR. In the stage 1, the GFR is greater than 90 ml per minute. In stage 2, that is in mild CKD, the GFR is between 60 to 89 ml per minute. In stage 3A, that is in moderate CKD, the GFR is between 45 to 59 ml per minute. And in stage 3B, that is in moderate CKD, GFR is between 30 to 44 ml per minute. In stage 4, that is severe CKD, GFR is between 15 to 29 ml per minute. And in stage 5, that is end stage CKD, The GFR is less than 15 milliliters per minute. The next test is imaging. The doctor may recommend a renal ultrasound, CT scan, X-ray or MRI scan to reveal how blood flows through the kidney or if there is any blockage or narrowing in the blood vessels. Next test is the kidney biopsy. A kidney biopsy is a procedure to remove a small piece of kidney tissue that can be examined under a microscope for signs of damage or disease. Now let us discuss about the treatment options. Maintaining your blood sugar control and lowering blood pressure are absolutely necessary to slow the progression of diabetic nephropathy. The first treatment option is the medications. There are medications available which have been found to slow down the progression of kidney damage. They include SGLT2 inhibitors, including bexagliflozin, dapagliflozin, empagliflozin, ertugliflozin, which help control high blood sugar. Angiotensin converting enzyme, that is ACE inhibitors, including ramipril, quinapril, and lisinopril, can help slow down the progression of kidney damage. Angiotensin 2 receptor blockers are medicines that dilate blood vessels and are used in the treatment of conditions such as high blood pressure and kidney disease in people with diabetes. Diabetic medications will be given to control sugar levels such as metformin, glucagon like peptide 1, and insulin. Late stage treatment options. If diabetic nephropathy progresses to ESRD, a person will need either dialysis or a kidney transplant. They'll usually need dialysis for the rest of their life or until a kidney transplant is available. Now let us see the precautions. See your healthcare team regularly to manage diabetes. Treat your diabetes. Manage high blood pressure or other medical conditions. Stay at a healthy weight. Avoid alcohol and smoking. Eat a healthy diet. Get enough sleep. And manage your stress.
Please like, share and subscribe to Expert Medical Coding. Thanks for watching.